Assalamualaikum and a very good day to all. My name is NURUL binti SAMAN, and today I will be presenting about the introduction and also the issue of our case study. Our group have choose Colombo Asia Hospital, which is a international private healthcare company that incorporated in Malaysia since 1996. So, Colombo Asia Hospital started their first hospital in Sarawak in 1997, and now Colombo Asia has offered 19 medical facilities, including hospital, clinic, and extended care of facilities across Asia, with 13 in Malaysia. So, leading. So, when we are talking about leadership, we cannot implement reform in healthcare and establish a new company culture without a solid leadership, because health and social service provider like Colombo Asia Hospital play an essential role in protecting the human health and well-being. So there is a risk that people physical and emotional might suffer if the healthcare organization fail to deliver high quality services to them. So healthcare leaders are accountable to ensure that the healthcare organization is safe, of the highest quality, and must be able to make critical decisions that can have a life or death impact on the patient health and also well-being. Therefore, they must have a knowledge and skill that necessary for them to do so. So the true leaders also must know the hospital mission, which to provide the best possible treatment with maintaining a high level of patient safety, and at the same time they have to boost self-belief and also increase the job contentment, because confidence will soar the level you never believe possible if you and your colleague find way to bring out the very best in every individual. So as a result, many workers feel that they feel restricted, since they don't believe that their efforts are recognized, acknowledged, or made a difference. So that is the common issue and common problem in workplace. So in Colombo Asia, there are many levels of leadership, including the top management, the managers, the doctor, the supervisor, matron, and also the nurses. So with this layer of leadership, it may cause a lot of issue and also a lot of miscommunication. So communication within the organization is very important, because especially in healthcare industry, because we know that the stress level and the pressure working in this sector that need to be faced by all the employee. So poor leadership in this industry can increase cost, reduce efficiency and effectiveness, and also can cause dissatisfaction among staff. So that can result them into lower patient satisfaction and also society, and also lower in the society health level. So the communication between the organization also is a huge challenge in this sector, because with this poor communication, it can create a tense on the environment, on the work environment, which is a very negative impact, and it is not healthy, because it can demotivate a person and can make them become less productive, and it can affect the organization itself. So in Colombo Asia, there are many issues in communication between, example between the management, between the superior, and also nursing department, HR department, because all of them are related to each other. As example, in case the registration counter don't deliver the correct information to the nurses counter, so they have um, the chances of there having a problem there is high, so that it can lead to medical error, or worse, it can affect the quality of the hospital itself. So that's all from me.
I will present about evaluation of the cases. Okay, effective leadership start with communication. Communication is the most important part in our daily routine and job. This evaluation of the case study will focusing on healthcare industry in Columbia Asia Hospital. The issue appear when we get bad leader with poor communication. If it can form with department, others, department, top management, patient, and among staff. Poor communication can lead in decrease the revenue, staffing issue, and bad reputation of the company. And I will present about the proposed solution, change, or improvement. When a leader discover a method to unlock the potential of their employee, they will observe positive effect. One of the solution is to be honest. If employee find out that they are being lied to, then they are very likely to look for a different job. Always keep promise to build trust between staff and the manager. Communicate with a plan so that staff feel confident with the leader. Get personal with them to build positive relationship. Listen to the staff. Be consistent in the communication so that they can trust the leader. Communicate equally with all staff to avoid favoring in the department. That's all. Thank you.
Recommendation and conclusions. So, leadership is about influencing, motivating, and enabling others to contribute toward the effectiveness and success of the organization, of which they are members. Honest. Apply in the leadership responsibilities will transform leadership in the organizations of Columbia Asia Hospital. Leader must transform a vision into reality requires employee commitment, and transformational leaders build this commitment in several ways. Based on Columbia Asia Hospital vision to making people better, the leader must be honest to train their workers and without evoking superior status and without being judgmental about others or defensive of criticism received. Train the staff how to treat patients and make patients feeling better will set the right direction as per organization's mission to deliver the best clinical outcomes in the most effective, efficient, and caring environment. Then, people are more likely to communicate message through impersonal channels that they would never say in face-to-face conversation. For example, social media typically enables users to develop a public identity through the social media content. Employees tend to be using the social media to be sharing information or forming communities, but less likely if they're choosing the wrong medium reduce communication effectiveness. Then, organizations rely on a variety of coordinating mechanisms. Frequent, timely, and accurate communication remains the primary means through which employees and work units effectively synchronize their work. Communication conveys knowledge that helps employees better manage their work environment. Leaders use influence to motivate followers and arrange the work environment so they do the job more effectively. If the leader keeps honest in their organizations, this may emphasize safety, operational focus, long-term productivity, and cost effectiveness. Columbia Asia Hospital is to always take care of their patients and clients. Dishonesty in leadership may improve the performance and well-being of co-workers and the overall team. To study the employees, the leader must able to know the organizational behavior, which is ready with the conceptual tools to work more effectively in the workplace. Organizational behavior that comes with visionary leadership, creative decision-making, communications, and many other organizational behavior practices are predictor of the organization's survival and success. Thank you.